everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm a general dentist with a practice in beautiful Portland, Oregon. My practice is dedicated to taking care of patients with TMJ disorders. Today's video is about COVID-19 and TMJ problems. So I want to be really clear by starting out and saying that COVID-19, the virus itself, does not cause TMJ problems, like the way it causes fever or lung problems or that dry hacking cough. It doesn't cause TMJ problems directly that way. However, there is an indirect correlation. So TMJ disorders of the muscles of the head, neck, and jaw, as well as the joints themselves, have a component to them that is psychosocial. So that means that there's a component to TMJ disorders that has very much to do with stress. Increased levels of stress equals increased TMJ problems. When our bodies and our minds sense stress and all the emotions that go along with it, frustration, anger, anxiety, sadness, what we kind of tend to do instinctually is just sort of sink our teeth into it, which is literally the action of clenching or grinding our teeth. Clenching and grinding can be an enormous amount of force, and it puts too much stress and pressure on the muscles of the head, neck, and jaw, as well as the temporomandibular joints themselves. So there's an entire article that I've linked below that shows the direct correlation between levels of stress and clenching and grinding. So please check that out if you're interested. I would venture to say that for the majority of the world, this COVID-19 pandemic has created an enormous amount of stress. I've known people who have lost a loved one to it. I've known people who have contracted it themselves, and they're worried about what that means for the future of their health. I've known people who have become depressed by the lack of socializing due to quarantine, and I've known people who have really struggled to balance home life and work life in a way that they've never had to do before. It's been a year for a lot of us. So essentially, that increased stress is something that most, if not all of us, are definitely experiencing. All of this increased stress has led to increased clenching and grinding. That increased clenching and grinding has then led to more fractured teeth than I've ever seen in all of my years doing dentistry. So when we clench or grind our teeth, we can generate 80 to 100 times more force than when we're chewing. So think about that. That's enormous. Think about taking a bite of a toasted crunchy bagel, multiply that force by 80, multiply it by 100 or more. Those are the types of forces we can generate when we're clenching or grinding our teeth at night, when we have no awareness of it, when we have no recall of it. So of course, all that force is going to go somewhere and something's going to give. Even though enamel is the hardest substance in our whole bodies, it's harder than bone. It is not built to withstand that kind of force, the forces that come along with clenching or grinding. And same thing with the muscles that surround the head, neck, and jaw, as well as these joints here. They're just not built to take that much force. Regular chewing and speaking forces, yes, of course, but all that extra force thrown into them night after night, day after day, it's going to add up and something's going to give. So again, I've seen more fractured teeth than I've ever seen, and I've also seen a huge uptick in cases with our TMJ patients. So that means that people have either had setbacks, or it's taken them longer to recover, or even that we are seeing more patients in general. So we've had patients walking in with locked jaws, with headaches, jaw pain, neck pain. Suddenly their joints are making noises that they were never making before. And I think it's fair to attribute a fair amount of that to increased levels of stress that we're all seeing this year, that we're all feeling this year. So to summarize, this pandemic, COVID-19, is causing increased stress. This increased stress is leading us to clench and grind our teeth more, which is then leading to broken teeth, locked jaws, muscle dysfunction, headaches, neck pain, jaw pain, tingling in the arms, vertigo, a lot. I've seen a lot. So I'm creating this video as a way to make you guys aware of this, make you guys aware that you might be clenching your teeth all day without realizing it, and sort of just give you some tools to get some help if you are going through this. So what can you do? I would say definitely if you're having moderate to severe levels of pain, try to see a TMJ doctor. What we do at my office is make custom-made mouthpieces that put the muscles at their correct resting length and align the joints to allow for optimal healing of this unit. If you can't see a TMJ doctor, I'll give you some sort of things that you can try at home. One thing that you can try is this topical cream that I've linked below called Theraflex. I had patients that swear by it. They used it all through quarantine when we were closed and they couldn't come in and get treatment. And they said it did help a lot with jaw pain. There's something else called the Dolphin Massager, and I have this at home. So literally it looks like a dolphin. And I've linked this below as well. But for me, I have a trigger spot in my trapezius muscles, especially on my left side here. So when I just hold it against there, it really helps to release that. So you can use this kind of all along the back of the neck and even a little bit further forward in here as well. So these are areas that we hold a lot of tension. I probably wouldn't advise using it on the jaw itself. We don't want to damage anything. So I was actually in a motor vehicle accident at the end of August where I was rear-ended and I got whiplash and my car was totaled, fun times, and my neck really took off after that. So I'd always had some mild chronic neck pain, but it became moderate and even severe some days. And so I started using this wonderful microwavable neck pillow. So you can microwave this, it gets nice and warm. I usually do it for about 1.5 minutes, and then I just place it around my neck, similar to one of those airplane pillows. And it brings a lot of relief to the tight and tense muscles. So that's something that's worked well for me. And again, I've linked that below too. There's a wonderful book called the TMJ Healing Plan that I've talked about in some of my other videos, and it has some postures, it has some exercises, some do's and don'ts that you can definitely try at home, and that's linked below as well. And then, of course, magnesium supplements. I always recommend those for people who are prone to jaw pain, neck pain, and headaches. Those are usually all caused by dysfunctional muscles, and magnesium is wonderful for those dysfunctional muscles. So I've linked that below in a formula that we really like to use because it makes the calcium and the magnesium that's in that supplement, it's in a form that's very bioavailable. So I like that supplement in particular. So that's also linked below. And then, of course, stay hydrated, exercise, meditate, have a nice, nutritious diet that's feeding your body and serving your body well. So being mindful and aware of all of these things is always good. And on top of that, I'm going to throw in one more challenge. Try not to clench your teeth during the day. So a lot of people will say, well, I don't do that. But assess yourself right now. Your lips should be together if you're listening to this video. Your teeth should be apart. And a lot of people, when I ask them to check on this, they find that they're clenching their teeth together literally all day long. So you can train yourself to stop doing that during the day. Set a timer on your phone for every 15 minutes, and every time your timer goes off, assess where your teeth are. You can't do really anything at night when you're asleep and you don't really have that awareness. But during the day, yes, we can help ourselves. So we can train ourselves to stop clenching our teeth. Things not to do. Don't have too much caffeine. Caffeine will dehydrate your muscles, and dysfunctional muscles need a lot of hydration. Don't lean your fist against your jaw or your jaw against your fist, however you want to say it, or sleep like this. It puts lateral pressure on these joints and they're not built for that, so it can cause problems. Don't open things with your teeth or chew on ice or bite your nails. All these extra habits are just putting extra forces on the teeth, the muscles, and the joints. So I hope this video provided you with some good information or some insight as to why you may be experiencing an uptick in your TMJ symptoms. If you liked what you've heard or you learned something, please click like below, comment. I'd love to hear from you guys. And please subscribe. Don't forget to hit that subscribe button. So I have so much more to come for you guys, including some patient testimonials in the near future. Thank you so much for your time, and I hope to see you all again soon.